This portion of the video will cover the preparation of reagents. The following reagents will be used for thermodynamic analysis: arachidonic acid 2 millimolar, 5 and 20 micromolar of adenosine diphosphate, and 4 micrograms per milliliter of collagen. The following is a list of supplies for reagent preparation. There is a very small amount of ADP reagent in the vial. Tap vial gently to get contents to the bottom. Remove cap and reconstitute with 5 milliliters of irrigation grade physiological saline. Invert gently to take up any ADP remaining on the vial's cap. Allow the ADP to sit at room temperature for approximately 10 minutes after reconstituting. Swirl to mix contents and then aliquot. For demonstration purposes and ease of viewing, we did not have reagents on ice. However, when making the reagents, all should be kept on ice throughout the whole reconstitution process. This is important to ensure sample quality. Label conical centrifuge tube 20 micromolar ADP. Transfer to a 15 milliliter centrifuge tube and add another 7.5 milliliters of irrigation grade saline. Mix. This is 20 micromolar ADP solution. Label a conical centrifuge tube 5 micromolar ADP. Transfer 3 microliters from the 20 micromolar tube into a second tube. Add 9 milliliters of irrigation grade saline. Mix. This is 5 micromolar ADP. Dispense 100 microliter aliquots of 5 and 20 micromolar ADP into separate 500 microliter microtubes. Label them respectively and store frozen at -70 degrees Celsius until the Reagents should be stored at 2 to 8 degrees Celsius or kept on ice, and the working stock is 8 hours. Arachidonic acid is an oily drop at the bottom of the vial that must be tapped, or as seen here, centrifuged on high for 3 minutes to force the drop to the bottom of the vial. First, tap the contents gently to the bottom of the vial of albumin. Remove stopper and reconstitute the albumin with 1 milliliter of irrigation-grade physiological saline. Mix with occasional swirling. Allow 15 to 30 minutes for the albumin to completely go into solution. Before use, check visually to be sure all albumin is in suspension. Break vial tip with cap cracker supplied. Pipette reconstituted albumin into both the tip and the body of the vial in 100 microliter aliquots for a total volume of 700 microliters. Make sure the arachidonic acid remaining on the sides of the tip where the body of the vial is mixed in by rotating the vial as the albumin is added. Vigorously mix the arachidonic acid into the albumin in both parts of the ampule using a transfer pipette. Combine the suspension from the tip with that in the body of the vial and continue mixing until the arachidonic acid suspension reaches maximum turbidity. Transfer the reagent to a microcentrifuge tube and vortex at highest speed for 5 minutes. The reconstituted arachidonic acid suspension should appear very milky with numerous small bubbles. Aliquot in 100 microliter volumes and freeze at -70 degrees Celsius for 3 months or -20 degrees Celsius for 1 month. Keep arachidonic acid aliquot on ice in the dark during testing and vortex for 2 minutes before running each test. Collagen is used as supplied and does not require reconstitution. Vortex the vial before removing aliquot as collagen fibrils are in suspension. Tilt the vial to extract aliquot, approximately 50 microliters. Use a sterile syringe and needle to remove enough for 1 week's use. The remaining reagent in the original vial will be stable until the expiration date noted if stored at 2 to 8 degrees Celsius. Keep aliquot on ice while testing. Invert, Swirl or flick the aliquot tube before adding 2 microliters of collagen to test sample. This is a final concentration of 4 micrograms per milliliter.